Hi everybody, welcome to the channel. Thank you so much for being here. In today's video, we're going to talk about Alzheimer's disease and I will explain to you what part of the brain is damaged and why the people who have been diagnosed with Alzheimer's disease present all the symptoms and behavior changes they do. Please stay tuned. If you are new in this channel, welcome. And for the people who don't know me, my name is Patricia, and I have been working with people with dementia for the last 29 years. If this is the first time here, I wish you all the best. If you haven't subscribed to the channel, please do and give us a like. In today's video, we're going to talk about Alzheimer's disease. I know it's a very extensive topic. What I'm going to do, we're going to create a few videos. What I will explain to you in a very easy and comprehensive way how Alzheimer's disease affect the people who have been diagnosed with this condition and what part of the brain is affected and why the people behave in the way they do. Usually is because there is an unmet need and they're trying to communicate with us so hard with all the tools they have available. We just have to realize that they are unable to talk, they are unable to find the right word to communicate with us. And if they doing with that the behavior they show us, that behavior of concern is because that's the only thing they know how to do it. They don't have any other tools or they don't know any other way to communicate with us. We have to understand as a carer, family member, friend, or relative that they trying so hard to communicate with us. And the only way they are able to do it is that way. Now, saying that, I just wonder if anybody asked before why they call Alzheimer's disease. Well, Alzheimer's disease it was named by Alois Alzheimer, who was a German psychiatrist who first documented the symptom in 1906. Alzheimer's disease is one type of dementia and is the most common one. At the moment, there is no cure for Alzheimer's disease. People who have been diagnosed with this disorder at the end of the condition become immobilized and dependent. Eventually, it's going to require extensive full-time care. And this is how we find people, sometimes in nursing homes or in hospital, unable to talk, unable to move, and they require 24/7 care from us. Now, what causes Alzheimer's disease? Apart from a few people with familial Alzheimer's disease, is no why some people develop Alzheimer's disease and others don't. But I mentioned here a new term, familial Alzheimer's disease. What is that? In a few cases, Alzheimer's disease is an heritage caused by a genetic mutation, and this is called familial Alzheimer's disease, with symptoms occurring at a relative very young age. This is usually when someone is in their 50s, but sometimes it could be younger. It doesn't mean that because you have a mother or father who was diagnosed in the past with Alzheimer's disease, you're going to get Alzheimer's disease. It's only a little percentage in there. Also, there are health and lifestyle factors that may contribute to develop Alzheimer's disease. And these factors as a physical inactivity, lack of mental exercises, smoking, obesity, diabetes, high cholesterol, and high blood pressure. It's very important for us to incorporate a little bit more physical activity. We need to go out 10, 15 minutes for a little walk. I know sometimes we have a very busy style life, but we need to incorporate a little bit of exercise just to minimize the risk to get Alzheimer's disease. The other factor is lack of mental exercises. Just remember that the brain is a muscle as any other part of the body. We need to exercise that muscle. Just incorporate the reading of a good book, and every time when you doing or finish a page, try to analyze what was the message of that page. In that case, you just put your muscle to work. Your brain is working. Try to analyze that and try to do that. And also go to the doctor to be checked and to see and check the levels of cholesterol and to be checked for the high blood pressure and diabetic. I think it's very important to do that. And if you do and incorporate a little bit more physical activity, a little bit more mental exercises, that you're going to reduce the factors that may cause Alzheimer's disease in later in life. Now, what is Alzheimer's disease? Alzheimer's disease is a degenerative brain disease that causes significant memory loss and impairment in a person's ability to carry out the daily tasks. In Alzheimer's disease, we see people they are unable to do the normal life, the normal activity or everyday life. And this is because it's a brain disorder that gradually destroy the thinking and memory. And all these become worse over time and resulting in memory loss and thinking impairment, and this is irreversible. This is condition that they cannot fix, they cannot be fixed. It's become worse and worse with the time passing. Now we're going to talk about causes and how the Alzheimer's disease damaged the brain. In 2006, there was a professor who was conducted research, and he found out a link between two proteins with Alzheimer's disease. And in Alzheimer's disease, there is a normal deposit of proteins in the brain. These called plaques and tangles, and they make up for the two key proteins that call amyloid and tau. Amyloid and tau are present in the healthy brain, but in Alzheimer's disease, they are functioning abnormally. Amyloid form plaques outside of the cells, and the tau form tangle inside of them. This plaque and tangle damage the nervous cells and causing them to die. When loss of cell die, this is make the brain shrink. And we see here in this picture how the amyloid and tau are forming that tango in the, and because of that the cells are unable to communicate with each other, and soon after they die. I'm going to show you now I'm going to show you now how a normal brain look like, compare one side to the other who is severe damaged by Alzheimer's disease. You can see here in Alzheimer's disease, the hippocampus is usually one of the first areas of the brain to be affected. The hippocampus have a vital role in forming memory, so someone in the early stage of Alzheimer's disease will often have trouble to form new memories. They might struggle to remember what they have just said or done and may repeat it themselves in conversation. More recently, memory are usually lost first. And we see here that there are a lot of people who remember what they have done in the childhood, but they can't recall what they have for lunch or what they have for breakfast. And this is why all the memory remain for much longer, and this is the reason why, because the hippocampus in here is being affected and the brain become smaller if we compare with the other part of the brain. All those changes probably happen in the brain longer before the first sign of memory loss appear. Researchers believe that the damage in the brain began a decade before or more before all those effects appear. The brain damage related to Alzheimer's disease seems to be started in the hippocampus, as I said to you before. And this is why, the people behave in the way they do. There's another part of the brain that also been affected, and this is the amygdala. Is often affected later than the hippocampus, and the amygdala play a big important role in the emotions, which explain why a person with Alzheimer's disease may record feeling of or emotion about an event or a person, even if they cannot recall the fact or what is the situation, but they still remember how you make them feel. And this is the reason, because remember the brain is affected and is the part of the brain become smaller. Well, I just hope that this video help a little bit to understand why the people behave in the way they do. Just remember to subscribe to the channel and follow me for more information. We're going to have to create a new video after that, and explain a bit more about Alzheimer's disease and how Alzheimer's disease affect the people with how Alzheimer's disease affects someone um, to live just a normal life. Have a wonderful week, and I hope to see you here next time, next week. Bye for now.